there's not going to be necessarily a wearing off effect for the most part. Now, sometimes when we do our injections, the inject date. So for example, we commonly see this if we use adipose tissue, where patients will get an anti-inflammatory effect from the injection. And that can be because some of the cells or even sometimes the platelets can exert an anti-inflammatory effect that is temporary, and that part goes away. Okay, so sometimes we see that in the initial stages, like the first week or two after an injection, patients might get insanely better, then that wears off at about the 1 to 2 week mark, and then the healing happens after that. Now, that can happen, but that's not really what we're talking about here. We're talking about after the healing has happened. So if we get healing, if we actually stimulate and trigger the body to go through a healing response, the effects of that are not necessarily going to wear off. And can you revert back to your original state? Yes, of course you can, and we're going to talk about some of those reasons. But it's not that the injections wear off, in the sense like when you get a steroid injection, the steroid exerts an effect, and then after a period of time, that effect wears off. That's very, very different. And I think that's maybe why a lot of people ask this question about like, oh, do the PRP injections wear off? Because I think they've kind of been conditioned with lidocaine injections or anesthetic injections and the steroid injections, because in those things, they do wear off.